We are back with Dr. Paula Duncan, a certified menopause specialist with Cone Health, talking about menopause. So a lot of people would want to know, okay, is there like a quick and easy way? Is there like a blood test to check hormone levels for menopause?
So there is a blood test that can tell us if someone is in menopause, but it really only has utility in certain circumstances. So that's women who have had a hysterectomy, so they no longer have their uterus. It would be for women who maybe have PCOS and which is polycystic ovarian syndrome, and they have very irregular cycles at baseline. Or for women who are very young and have stopped getting their menstrual cycles, and we want to make sure that they don't have premature ovarian insufficiency. But for most women, the most reliable way to tell if someone's perimenopausal is based off their age, but also looking at what are their symptoms. And I think that also falls on us as physicians to believe women when they come in and tell us that they're having a problem.
Does the blood test not work because the hormone levels go up and down so much?
Correct. That's absolutely correct. Yep.
Okay. All right. Because like what the blood test that you gave on a Thursday and the blood test that you gave on a Tuesday might be totally different things. And so,
Yes, any given
all right.
time, any given month, or even within a single month, we could check that result and we would get completely conflicting results.
All right, because yay, women, your hormones go like this, like a roller coaster. All right, so what are some common misconceptions or maybe outdated information that you'd like to set straight?
Yeah, I think the biggest is just the original interpretation of the Women's Health Initiative study, which is where a lot of like the fear, both from providers and for women, when it comes to prescribing hormone therapy. And it was basically where it started saying like women are increased risk of heart disease from it and increased risk of breast cancer. But really, that took the nuance from the study and wasn't quite accurate, and how it was presented was also misleading. So we went from many women being on hormone therapy to almost nobody being on hormone therapy. And think about, there's a lot of harm that came from just how that was interpreted. So when I see patients, I talk a lot more about the nuance of what that study showed, what hormones were used in it, how we don't use those hormones anymore. So we use a very different regimen, most practitioners do. um, and we don't think that hormone therapy causes breast cancer. And in fact, in some arms of the study, it actually showed a decreased risk of breast cancer. So bearing that in mind, there's again a lot of nuance to that, which is great to have with your provider. And I had a patient recently put it really well in terms of talking about breast cancer risk. And, she put it in the coolest way possible. She said, so it doesn't really start the fire, but it could add fuel to it. And I think that that's really well said. So if you have hormone receptive breast cancer, it's not that it caused it, but it might feed that breast cancer. And
And
I think
that's
we
why
kind
you
of
need some preventative screenings and things like that to go along with that.
yeah, so getting your mammogram. And we kind of touched on this where hormone therapy is not the magic bullet for all symptoms of menopause, but if we can even make some of them better, that's really what our goal is. So having an honest and frank conversation about what will work and what will not.
Okay, we've got about a minute left. As we wrap things up, what's the most important thing that women should know about menopause?
So I say the most important thing women should know is that it is not a pathological state unless you are under 40. So if you're very young when you go through menopause, that all women with enough time go through it. And so we don't want to over medicalize it, but also we should address it. And if it's affecting your quality of life, I highly recommend seeing your provider. And if your provider is not comfortable, know that there are many who are. It doesn't take a specialist to do this. It just takes a physician or a provider who is willing to take the steps to stay up to date and be educated. And I think being an advocate for your health and not maybe taking that first answer, if your doctor says they're not comfortable, persist, because this stuff matters, both for your long-term health and for your quality of life.
Yeah, it's not just the today symptoms, it's the bone loss and all that other things
Yes.
down the line as well. All right. Thank you so
Yeah.
much for your time and your expertise. Maybe you want to send this interview to a friend or a family member. This is going to be in the To Your Wellbeing section of our website.